Welcome to 3 Minutes of History. I'm your future history teacher, Chris Oxenford, and let's get started.
March 26, 1953. Dr. Jonas Salk, a medical researcher at the University of Pittsburgh, announces to the world that he has successfully developed a vaccine against infantile paralysis, otherwise known as polio, and that he will soon begin testing it. Polio is a contagious disease that causes a wide variety of symptoms, which include fever, sore throat, headache, vomiting, fatigue, pain or stiffness in the neck or legs, and muscle weakness. In more severe cases, the disease can cause either permanent or temporary paralysis, or it can cause death. The disease tends to affect younger children, although cases can occur in adults. Polio has been affecting human beings for most of recorded history, although it did not truly become epidemic until the 20th century. The first serious polio epidemic occurred in Vermont in 1894. A few years later, in 1916, a serious polio epidemic occurred in New York City. Over 27,000 people were affected by the illness, and they and their families had to be quarantined in their homes. Over the next 30 years, until the invention of the vaccine, there would be major polio epidemic somewhere in the United States every summer. The most common treatment for polio was the infamous iron lung. The iron lung was a large, expensive machine that worked to help paralyzed patients breathe by pressurizing and depressurizing to cause their chests to expand. Among those afflicted by the disease was future United States President Franklin Delano Roosevelt. Like many adults stricken with the illness, Roosevelt lost the use of his legs as a result of his infection. Among the many treatments Roosevelt tried to regain the use of his legs was swimming in the waters of Warm Springs, Georgia, which were reputed to have healing properties. Although they did not fix Roosevelt's illness, he did regularly return to Warm Springs, including during his presidency. He purchased the White Springs facility in 1926 for $200,000 and used it as a polio rehabilitation center. In addition, in 1938, he helped to establish the National Foundation on Infantile Paralysis that would fund efforts to help treat and cure polio. The organization would go on to become the March of Dimes, which continues to try and treat and cure all childhood illnesses. Among the grants made by the National Foundation was support to Dr. Jonas Salk. Salk was born in New York City. He studied medicine at New York University and studied viruses at the University of Michigan. During World War II, Salk worked to develop flu vaccines. In 1947, he joined a research lab at the University of Pittsburgh, and a year later accepted a grant to study the polio virus. Salk studied the virus, and just 2 years after accepting the grant, had developed a prototype of his vaccine. The Salk Vaccine works by taking a dead or inactive strain of the polio virus and introducing it into a patient's bloodstream. The body would then develop antibodies that would kill off both the dead virus and any future infections with polio. Salk tested the first vaccines on himself, his family, and 161 patients. When the results proved promising, Salk reported to the National Foundation for a major clinical trial and announced that he had produced the vaccine on the radio. On April 26, 1954, testing of the Salk vaccine began. The test of the vaccine was the largest in American history, with 1.8 million children participating. The trial was one of the first double-blind trials in which neither the doctor nor the patient knew if they were receiving a placebo or the actual vaccine. After a year of study, the results proved that the vaccine was 80 to 90% effective in preventing polio, and these results were announced publicly in 1955. Although the Salk vaccine was proven effective, a few years later, Polish-born scientist Albert Sabin produced an oral version of the vaccine that was cheaper and even more effective. By 1979, through the use of the Salk and Sabin vaccines, the United States had its last naturally occurring case of polio. Salk was hailed as a hero for his work on the vaccine. In 1977, he received the Presidential Medal of Freedom, the highest civilian honor in the United States. He established the Salk Institute in California as a place for research and study, and in the 1980s tried to develop a vaccine for HIV and AIDS, although he was unsuccessful. In 1995, Salk died of a heart attack.
This has been 3 Minutes of History. I'm Chris Oxenford. Thank you for joining me.